Here comes the last video for color vision. Okay, the additional clinical considerations. Okay, so we're going to look at what are the additional information that you have to know about color vision related topic. Okay, first is the inherited anomalies. Although inherited anomalies of color vision remain stable throughout life and pose no threat to vision, they can interfere with the performance of many visual related activities. For example, when they were kid, right? When it is a kid, okay, it is very troublesome because they always get misunderstood of being a lazy kid for not remembering the colors, okay, properly, because that's the age, the age like a 4 or 5 years old, where the kids will be playing with different colored toys, and then the parents have the habit of asking what color is this toy, what color is that toy. So when they make mistake, and then the parents or the teacher will be teaching them again and again, but they still make the mistake. So initially, in 10, 20 years back, it is an issue because the kid will be usually labeled to be having, to be lazy, to not interested in education. So they get, psychologically, you know, trashed down. Okay, so there are many things were happening, but thank God for the advancement of technology, by, with social medias, many awareness are being actually spread out to people. Okay, including the education system for teachers. Okay, they are more aware now. The teachers are very aware that if, let's say, they have this kind of kid, right? So the teachers have awareness that color vision blindness is actually there, color vision deficiency is existing. So a kid can be not recognizing colors because of this reason. Okay, but previously 20, 30 years back, it's always like labeling the kid of not interested, not remembering things, lazy kid and all that. So that would be one thing that was our concern for many, many years. Even till now, they are still kids who are being labeled to be lazy, okay, because of this issue. So that will be one. Next, when it comes to working adult, okay, or just finish studying and ready to choose their job. Okay, many people have like many ambitions, these kids, school going kids, university going kids, they have to choose a pick the correct course for themselves. Like for example, uh, um, when you ask a kid when they are young, right, they would just simply say that I want to become a policeman. I want to be, pilot. Okay, so there are many things that they dream of. Okay, but if let's say you're able to diagnose this kid at a very early stage, okay, and if let's say you're able to actually let them know that, these are the jobs that you can't do. Okay, like for example, a pilot, firefighter, policeman, driver. So these are the job that they cannot actually go in. Okay, because they have the limitation of the vision, so that they don't get disappointed at the age of 17 or 15 when they are, then they need to choose the right pathway, whether they want to enter science stream or art stream, what is their future, what is the ambition that they have, what they want to be and all that, right? If let's say they are counseled at a very early stage, so that will be very beneficial for the patient. Okay, so this is role of optometrist. So although it may look like this color vision problem is not like a crucial one like myopia management and all that, but in a way it is also need to be managed in a proper manner, cannot be taken into granted because the prevalence of color vision deficiency is low. Okay, and with the people have more awareness, but people don't know what to do next. So we as an optometrist, our job is to actually guide these people to the right pathway. Okay, another concern would be driving. So driving is another thing, because when a person goes for this driving test, right, they will have to answer this color vision test. So that will be an issue for this patient, because driving is like a core things that we do daily. So with the color vision defect, obviously legally, you shouldn't be driving. Okay, so that is also another concern that that you should have when it comes to dealing with this patient who is just diagnosed with color vision anomalies, and you need to counsel them with all these, problems that they will be facing in their daily life. Okay, so children with color vision anomalies are sometimes incorrectly labeled as low learners, possibly resulting in psychological trauma. Not in the current generation, but previously, yes, like, about 10, 20 years ago, before the advancement of technology, before the forwarded WhatsApp messages culture. Okay, so there were many problems as such. Okay, now people are aware of what's happening in the world. Certain occupations related to public safety, airline pilot, firefighter, policeman, okay, may have color vision standards that exclude individuals with anomalous color vision. So this is crucial to be explained to the parents and also the kids who are having color vision anomaly, so that they don't dream without the knowledge that they have this color vision problem and they can't actually be in this job and then get disappointed later in their life. Okay, so better to warn them at a very early stage. And then for other professions, including electrical engineering, pharmacy, optometry, ophthalmology, dentistry, surgery, and normal color discrimination can be an advantage. It doesn't mean that if you have color vision deficiency, you cannot be one of them. Okay, so so that is the advisors and also the things that you should have in your mind when you are dealing with patients who are having color vision problems. So colors that frequently confuse in red, green chromacy, dichromacy. Okay, basically you as an optometrist, you have to know what are the colors that they got confused, first of all. Second thing is to make the people surrounding the patients who are having color vision defect is very important. So you have to explain to them. Okay, so if let's say you're advising the parents, right? So the parents should know that they have this problem in differentiating pink and gray. They will appear same for them, so that they are in the same line with the patient, so that they don't trouble the patient much with doing something that related to this. That's going to be very frustrating for the patient. So you need to explain to the parents that these are the colors. They will be getting confused, because we normal people, we don't know how the abnormal people actually sing, and the abnormal people don't know how we are seeing, because they have a different color perception overall. Okay, so the family members should know what are the things that actually seen by the kid that they're having, or the spouse, whoever they are bringing in with the color vision deficiency. Okay, now when it comes to this color vision deficiency, right? Okay, other than counseling, is there any other management? Okay, so there are many suppliers, many tinted lenses, many contact lenses are there in the market. But is there any standard way of, like, like for example, if let's say a patient is actually having refractive error, you just need to do refraction and then you prescribe accordingly. Okay, unless if let's say patient have accommodation problem or some binocular vision related problems and all that, then you will actually give like a minus lens, plus lenses, or increase the plus power, or decrease the plus power. So we have this kind of adjustment. So basically it starts with refraction and then you start it up. But when it comes to this color vision deficiency, right, it's difficult. Okay, it is very much depending on the individual themselves. Recommendation is there outside, but you can attempt that, but you cannot simply prescribe straight away. You have to let the patient know. If let's say a supplier say that this yellow tint will work, or this special tint will work for patient with color vision deficiency. Yes, you can have the trial version and you try on the patient, let them get adapted, and then see whether it's still helping or not. Because when they actually use these tinted lenses for the first time, right, the appearance might look very new for them. Then they find it like, oh, that's very interesting. I can see things different. Okay, the world might look different, but whether that is going to be beneficial for their daily activities, that matters when you want to prescribe the tinted lenses or any lenses that is actually recommended for color vision patient. Okay, so you have to actually let them try, and then you have to ask the patient the correct question. Yes, your world look different now, but is the task that you want to perform is actually, you're benefiting from this lens or not? If it is not benefiting, don't use it. Okay, do not prescribe to the patient. So the recommendation, so we're going to look at certain recommendation. Dane et al., this is one of the goddess of color vision, who's into this color vision, Stephen Dane, yeah? Okay, demonstrated that certain no neutral tints, such colors other than gray, may make it more difficult for these individuals to detect and recognize traffic lights. Okay, so these results suggest that tinted lenses should not be recommended for patients who have anomalous color vision. So this is what I meant, what I mentioned. Okay, suppliers may come with many suggestions, but whether it actually makes sense, work for the patient, it's still questionable. Okay, proton anomalies have been associated with an increased frequency of rare and automobile accident due to the diminished ability to see red tail and brake lights. Okay, so these individuals may also have difficulty seeing red traffic lights. This is the reason why it is not recommended, for color vision deficient people to drive. But we follow the rules. Okay, as an optometrist, you can always advise patient according to the rules. Please be ethical on that. Although practically it doesn't work, but ethically we have to advise them according to the law. Okay, as I mentioned earlier, lighting conditions, this for color vision testing. Okay, commonly used color vision tests are designed for administration under standard illuminancy lighting conditions. That is the standard one that we have under the box. Okay, so the Macbeth lamp provides illumination very similar to that provided by illuminancy and serves as an excellent light source for administering color vision tests. Unfortunately, this lamp is not readily available in all places. It is not like you go to a lamp shop and get one. Okay, so if an unfiltered incandescent source is used, it is likely that the patient will perform better than if the proper illumination were used. Because of its uneven wavelength profile, standard fluorescent lighting is generally not advisable. Okay, you can have the incandescent source, but place it further away, but not the fluorescent lighting. Okay, so alternatively, color vision testing can be performed using indirect sunlight. Okay, so that will be another option. So if let's say you're using incandescent source, making it far away, the ceiling, on the ceiling, and avoid using fluorescent lamp. Okay, the best would be the sunlight. Okay, indirect one. And another option would be the X-chrome lens and colored filters. Okay, the X-chrome lens is a read contact lens worn on one eye that is designed to improve color discrimination. Although this contact lens is prescribed for dry chromacy and anomalous trichromacy, it is most easily understood by considering its effect on monochromacy. This lens is a long pass filter blocking short wavelengths and transmitting longer wavelengths. Again, although it is actually found to be appealing, okay, for patients who are having color vision anomalies, but please do not prescribe this without attempting on patient and letting them to adapt before make the decision. So that would be my recommendation. Don't ever simply prescribe any tinted lenses or any contact lenses, any filtered lenses without letting patient to try and get adapted for at least 1 hour or 30 minutes. Okay, let them do the task that that they do daily and see whether it benefits them or not. If it doesn't benefit them, then don't prescribe them. Okay, so that should be the last slide. So I'll just like to recap what we learned throughout all the video recordings. So the first one, light goes into the eye in the form of light. Okay, and then it triggers the retina through the cone photoreceptor to actually send signals to brain, and then the brain will differentiate the light colors with the information of the wavelength. So that's how we able to differentiate the wavelength. So with the differentiation of the wavelength, we will be able to perceive the colors. And then we looked into the characteristic of the colors. Okay, so how the colors is being differentiated. And then we looked into the theory of the color vision. So the theory of color vision, they believe that the scientists believe that there are three types of cones. Okay, one scientist believe that it is a cone that is sensitive to long wavelength, medium wavelength, and short wavelength, while another scientists believe that it works like a channel, red-green channel cone, blue-yellow channel cone, and also black and white cones. So, and these are the two theories that is acceptable worldwide and still being used. And then we looked at the color vision system. So color vision system, okay, the first one that was developed was this Munsell color vision system, which looked like a catalog in a paint shop. While another one is the CIE diagram system, okay, where it is actually, developed further to become a proper color vision system for the current industry that we have now, all the, chemical industry, textile industry, photography, and all that, they're using the CIE diagram color vision system. And then we looked at the classification of anomalies of color vision deficiencies. So the classification starts off from one, there are two types. One is genetic, another one is acquired. So genetic is the one that you carry from your ancestor, while acquired is due to the ocular condition that you have, and also because of the drug usage, okay, secondary to that. And then it is classified further to red-green defect, blue-yellow defect. So red-green defect, it is further classified proton, deutan. Blue-yellow defect is further classified to triton. And based on the dichromacy and anomalous trichromacy, it can be further classified in detail. So dichromacy means they have only two types of cones. Okay, while anomalous trichromacy, they have three types of cone, but one is not functioning fully. So after that, we looked into the the standard test that is used to detect color vision anomalies. The first one is we looked at Ishihara plates. Okay, helps us to determine red-green defect, and then we have HRR SPP1 and SPP2. Okay, and also we have the City University. That will be the book version. Then we also have this arrangement test, which is the D15 test, desaturated D15 test, 100 hue test, and then we have the gold standard, which is the Nagel anomaloscope. Okay, so we looked into all these tests, and also we looked at on how to counsel this patient. So basically, if let's say a patient comes with color vision deficiency, nothing can be done much. We can diagnose them, we can give them the diagnosis, but the treatment for it, there are two. One is counseling, obviously. Okay, tell them, if let's say they're kid, okay, tell them what are the job opportunity in future, that cannot be selected due to the color vision problem. Okay, how driving can be affecting, can get affected. And the next one is the filtered lenses, S-chrome lenses, tinted lenses. All that is an option, but this option can be only prescribed to the patient if patient is able to actually get adapted. Okay, and it doesn't cost, get adapted. That means we let them try, adapted, and then if let's say the patient is actually finding some, advantage with that lenses, then only we prescribe that. So otherwise, we don't prescribe this, the lenses, okay, that I mentioned earlier. Okay, so that would be the summary of all the pre-recorded lectures that I have uploaded. Okay, next we will see during the lab session. I think the lab session should come after this pre-recorded lecture. Okay, and we will actually hands-on on all the color vision tests that we have. We have all the color vision tests that I have mentioned in my lecture. So we're going to do hands-on on that, okay, and see, we will be doing, I will let you to perform, and then we will together sit and, record the form, and then we will sit together to interpret it, okay, together. So you will have a better understanding on what I have discussed now. Okay, if let's say you have any questions, please do not hesitate to WhatsApp me. You can text me through Blackboard. Okay, and also you can, save all the questions when you come face to face for the lab session. We can always have a discussion of, the questions that you have in mind related to color vision. So that's all. Thank you so much. See you soon. Bye-bye.